summary of the goal is there.
How much would the tax raise?
If we increase the tax by $1, it would bring in an extra $10.2 million. If you increased it by $1.25, it would bring in $12.1 million. And those are conservative estimates. Those projections were provided to us by the Campaign for Tobacco-Free Kids, which is a national organization that works to reduce smoking.
Great, thank you.
Am I right to assume that the percentage of Vermonters, both high school students and adults, has sort of hovered at around 20%, low 20% for years?
Yeah, it's stalled. We've made great progress. The adult vote rate went from like 22% to 17%. That stayed the same for the past 2 years. The youth smoking rate started at 33% when the tobacco program started in 2001, and it dropped down to 16, which is great, but you were right. The last 5 years it stayed at 16. And where we're concerned is high school seniors and young adults. It's now over 20%. And that's going to be a really tough audience to address without a significant increase in the tobacco tax, but also without an effective well-funded tobacco program.
Why do you think that's happening? I mean, you've been very active in the last 5 years. There are all sorts of educational programs out there for students. Do you have some thoughts about why this is happening?
Well, we've seen a gradual decrease in funding for the tobacco control program. It's gone down slightly every year for the last number of years, so that is a big concern. And also, when we have raised cigarette taxes in the last few years. We've had a couple of increases, but unfortunately what we've seen are incremental increases, so a small amount 1 year followed by a smaller jump in the next couple of years. And the really important message about tobacco taxes and cigarette taxes is that we want to see a significant increase at one time, because that's what helps people quit it. It's that immediate jump at a price point.
The overall price per pack of tobacco would have to be increased by at least 10% to be an effective public health tool. Because as Nicole said, the tobacco industry can raise and lower its prices so you don't really feel the bump. And it doesn't deter anybody from smoking. So if you raise it at least 10%, studies have shown that adults will quit at a rate of 3 to 5%, and youth even higher. There will be a 7% decrease in smoking for youth and a 10% increase in the pack price. And our pack price right now is about $6.50 in Vermont. That's with all the taxes and the cost of the pack itself.
What's the retail price average?
$6.50 per pack.
That's the retail price?
That's with the tax included.
Okay. What's the tax?
Right now it's $2.24. Would be $3.24 if we raised it. New York's is at $4.35. So as I mentioned earlier, even if we bumped it a whole dollar, we'd still be $1 less.
New York is at what?
$4.35. And we do have a fact sheet that shows all of the prices in the region. We're third lowest right now. Just New Hampshire's below us. At I think $1.78, but it's in the material we provided. But New York is the highest in the nation right now. They border us. So it makes sense, obviously, from a public health point of view, to increase the tax because of the savings we could have in all the use that we would direct from smoking, and yet the state would still receive significant income from the cigarette tax.
What cuts are proposed in the governor's budget to the smoking program?
The tobacco program?
Yeah, how much?
He's proposed an overall $2.1 million cut to the program. It's a $4.5 million program. But what's very concerning is the program is made up of 3 different parts: the health department, the education department, and the Department of Liquor Control. The lion's share of these cuts would come from the health department, $1.9 million. It's about $1.2 million in one-time general fund money that's taken away, and $700,000 of tobacco settlement dollars that's taken away. But that part of the program provides cessation services for Vermonters, media and public education, community coalitions, and it's our understanding that most of that would come from cessation resources. There would be no more hospital in-person cessation counseling for smokers paid for by this program. There would be no more online cessation counseling available as well, and it would be a huge hit to the media and public education budget. That's about $1 million now. And I think they plan to go ahead with $300,000 in spending for media and public education. So that's the Common Aim campaigns that help kids to quit that they work in the community coalitions with. You might have seen the 8 out of 10 campaigns. Just promoting the cessation services, it's a giant cut. I think what they're relying on to do some of that work is using the ERA federal dollars, but those will go away too. So we need to sustain this program. That's infrastructure that's lost when we lose all those
So
counts.
they're proposing a backfill with some federal money.
The health department already has some money, and this year only, it's the ERA money, federal stimulus money. It won't be around next year, so it's kind of a patch. What's great about this program, it's one of the few programs that's evaluated. There's a group called Research Triangle that evaluates the program. One of the things they constantly say, if we wanted to do more, what would be very effective is media, public education. We haven't had the money to do additional things to target the groups that we've talked about, like the youth. Say nothing about the low-income community. Their smoking rate is 36%, and mental health is 44%. So we have to do more, not less, if we think we're going to.
So the cuts are cessation.
Cessation,
Does
media.
that include media or media services?
It's under the health department, but it's separate, but it kind of works hand in hand because it promotes the quit line, the quit services, but it does, the counter marketing messages that kids from smoking.
I couldn't help but notice that your poll results almost mirror the smoking rates. So would it be a surprise if a person who doesn't smoke says, split it up as high as you want, I don't care. And the person who does smoke says, don't touch it.
No, in fact, if you look at the poll results, if you look at the poll results that we have on the table, across every kind of a demographic, smokers, non-smokers, income levels, education levels, Republican, Democrat, there's broad support for the tax. There isn't one area that really shoots down. In fact, even smokers is one of the highest, smokers and former smokers is one of the highest areas of support for the tax increase. As Representative Till said, most smokers want to quit, and many tried last year. It's very difficult, and nicotine is a very addictive drug, so they need some resources to help quit. And what's been wonderful about the tobacco program is you have these cessation counselors that help smokers quit, and if you fail, it's not your only shot at it. They will call you back. They will keep trying. And they have been very effective. 20,000 Vermonters have quit smoking since the program started. Maybe not necessarily just because of the help of the counselors, but because of the comprehensive package, and that's what we want.
So you've talked about how higher percentage of low-income folks smoke. Does this tax